The D3 and K2 pairing is one of the most recommended supplement combinations in the world right now. The advice is everywhere, and the underlying science is legitimate. But there is a specific condition that almost none of this advice addresses. After 50, your cardiovascular system, your blood coagulation pathways, and your cardiac rhythm have shifted in ways that change how this combination behaves inside your body. Today we decode the missing context, not to tell you this supplement is wrong, but to tell you what the dosage guides are not telling you. Welcome to Mind-Body Files. Today we decode exactly what happens inside your cardiovascular system, your blood coagulation pathways, and your cardiac rhythm when you take vitamin D3 and K2 after 50. To be completely clear, the science behind the D3 and K2 pairing is legitimate. Vitamin D3 significantly increases your body's absorption of calcium from your diet. But D3 simply brings the calcium into your bloodstream. It does not direct where it goes. Without guidance, excess calcium can deposit into your arterial walls, leading to vascular calcification. This is where vitamin K2 comes in. K2 activates a specific protein called matrix Gla protein. This protein binds to calcium and directs it away from your arteries and into your bones where it belongs. The theory is well supported. The benefit is real. But this advice stops accounting for something critical when it ignores how the mature cardiovascular system responds differently after 50. The first condition involves cardiac rhythm, and the specific form of K2 used in most commercial supplements, MK7. MK7 has an exceptionally long half-life. It stays biologically active in your body for up to 72 hours after a single dose. While this makes it highly effective for directing calcium into bones over time, it also means the compound is continuously present in your system and in mature adults. This extended presence affects the autonomic nervous system. After 50, the heart's electrical conduction pathways become more sensitive to sustained shifts in fat-soluble nutrient concentrations. Clinical observations have documented cases where high doses of MK7 appear to temporarily affect the heart sinus node, the natural pacemaker that controls your heart's rhythm. The result, for some adults, is unexpected heart fluttering, a racing pulse, or irregular beats that can be quite unsettling. This is not a panic attack. It is a biological reaction to sustained MK7 activity in a cardiac system that has become more electrically sensitive with age. The second condition involves medication interactions that are rarely addressed on supplement labels. After 50, a significant number of adults are on low-dose aspirin, blood pressure medications, or prescribed blood thinners to support cardiovascular health. Vitamin K is the primary nutrient your body uses to regulate blood coagulation, the clotting process. While K2 behaves somewhat differently than the K1 found in leafy greens, therapeutic doses can still interact with the precise calibration of anticoagulant medications. Introducing a potent K2 supplement without first checking your baseline can shift your clotting response in either direction. It can either reduce the protective effect of your medication, or it can create an unintended shift in your blood's clotting behavior. If you are on any prescription that affects your blood or your heart, this is the conversation to have with your physician before adding K2. There is a third layer to this picture that very few supplement guides address. Many adults over 50 carry low-grade chronic systemic inflammation. This chronic inflammation damages arterial walls, and when arterial walls are damaged, calcium naturally rushes to those sites to form a protective response, much like a scab on skin. The problem is this: supplementing with high-dose D3 increases the calcium available in your bloodstream. If the underlying vascular inflammation is not yet addressed, more available calcium can potentially accelerate that protective calcification response rather than redirect it. You cannot simply supplement your way out of arterial calcification if the root cause, chronic systemic inflammation, is still actively damaging your blood vessels every day. The sequence matters. Inflammation first, then calcium management. If you want the benefits of D3 and K2 without these conditions, Here is the precise protocol for your biology after 50. First, request a serum calcium test and an ionized calcium test alongside your standard vitamin D level. This tells you exactly how much calcium is already circulating before you alter your chemistry. Second, if you are currently taking K2 and experiencing any heart sensitivity, unusual fluttering, irregular rhythm, or sleep disruption, ask about switching from MK7 to MK4. MK4 has a significantly shorter half-life. It clears your system in hours rather than days and is far less likely to produce sustained autonomic effects in a sensitive cardiac system. Third, start with a microdose approach. Rather than taking a full therapeutic dose daily, introduce K2 every other day at a minimal dose and monitor your morning resting pulse for the first 2 weeks. Your body's response at low dose is the most useful data point you have. Biology is forgiving. Your body does not need a high-dose approach to stay well. It needs precision, safety, and a deep respect for how your physiology has changed. The right nutrients at the right dose, at the right time, in the right sequence. That is the difference between a supplement that supports your system and one that creates work for it. Everything we decoded today connects directly to files on this channel. The hidden traps of supplement overuse, the mechanics of vascular aging, and the biology of chronic inflammation. If this gave you clarity, subscribe and turn on notifications. Every week we decode one more signal your body is sending, calmly, precisely, and without alarm.